Hi, my name is Karissa Thueson. I'm a neonatal nurse practitioner with MMG Health. I am excited for this opportunity to talk about preeclampsia and specifically the effects that it has on newborns. I love working in the NICU and I'm passionate as a mom myself about taking care of moms and babies. So this is a bit of a complicated question. Just like all the rest of preeclampsia, there's a lot of unknowns that go into it. I would say the biggest impact on newborns that preeclampsia has is that oftentimes the only treatment for preeclampsia is delivering the baby. And so that can mean a premature delivery of the baby. There's also uteroplacental insufficiency, meaning that that blood supply, which is the lifeline for the baby, can oftentimes be restricted, which means you might have a baby that's born early, but you also might have a baby that's born small. Even though they're born early, they're small compared to other babies born early like them. And those two things, premature birth and small weight, can significantly increase the risk of mortality in babies. A lot of the complications of being born to a mother with preeclampsia are really related to being born early, being born prematurely. So there are some studies out there that suggest even babies born closer to term are at higher risk for breathing difficulties, low platelet count, which platelets are what helps our blood clot, which can ultimately lead to bleeding in the newborn in places that you don't want bleeding, like their brain. It can also lead to low white blood cell counts. And again, white blood cells are what help us fight infections. So these babies are at even more increased risk for having an infection. A lot of the complications and long-term ramifications of preeclampsia on newborns really has to do with being born early. So any of the long-term impacts will be the same as any baby that's born prematurely. But there's one side effect of preeclampsia that I think is unique to these kinds of babies. And that's that mothers are at subsequent risk of having preeclampsia with future pregnancies. And so, as a mom, I think it's important to know that while the NICU can be a really stressful place and nobody hopes to be there, um, it might not be the right time to have that conversation. But moms should know that once you've had preeclampsia, you're more at risk with future pregnancies. Not necessarily related to preeclampsia, but I will say that have I've seen that sometimes moms with preeclampsia need a little bit of extra help in the NICU, remembering that they are still the mom of this baby. Oftentimes with preeclampsia, you end up delivering early and it's relatively unexpected. Nobody wants or hopes or dreams that their baby's going to end up in the NICU when they're making their birth plan and they're picturing the delivery and the birth of their baby. Nobody pictures it happening in the NICU. So one thing I tried to do is remind moms that even though their birth maybe didn't go the way that they planned or the way that they hoped, that it still is their baby and they still have the opportunity to do all of the things that they hoped and dreamed that they would be able to do. I make sure that moms know that we still want them doing skin to skin time, that we still want them working on breastfeeding if that's their goal. If that's important to them, it's important to me. Um, I want whatever mom's goals and hopes for her delivery and baby to come to pass, that we support that and to try not to interrupt it as much as possible. I wish that there was a cure for mother's guilt. As a mom myself, I find myself taking accountability for everything that happens to my child. I think it's just part of being a mom. It's hard to take that away from somebody. But as a NICU provider, it's important to me that my moms know that preeclampsia is not something that they did wrong, that it's not something that could have been prevented, that sometimes it just happens and we don't really have a good reason for it. I've seen young moms, I've seen older moms, I've seen healthier moms, I've seen, moms with certain medical complications. Nobody's immune to it. Everybody, across the spectrum of people are at risk for preeclampsia. So I'd like to, as a nurse practitioner in the NICU, I like my moms to know that first and foremost, that this isn't something that's their fault. They didn't cause the preeclampsia. Once I get that clear to these moms, the next thing I like to focus on is that they're not alone, that this does happen to quite a few people, and that there's lots of resources out there, whether support groups or internet communities, things like that, that whatever kind of tribe you like, that there's a tribe out there for preeclampsia and eclampsia moms. And so you're not alone. You're not alone in this. I also, I really like my moms to know that they're still really good moms and their baby is lucky to have them in their lives. That's a good question, and one that I think it is important to understand that it isn't preventable, that you can't necessarily change whether or not you get preeclampsia, but what you can change is how quickly it's recognized and how quickly somebody is intervening on it. So my best advice in that is to receive regular prenatal care, meaning all of those appointments, which again, I'm a mom, I've been there. Seems like you're going to a doctor a lot. And if you are high risk for preeclampsia, if they notice early signs of preeclampsia, you might be going to the doctor more frequently. But that's important because the more severe your symptoms of preeclampsia are, the more likely it is to impact your baby. And oftentimes that means the smaller your baby could be. So the best thing you can do is go to regular prenatal visits and follow the advice of your doctor. So something that I am learning still and something that I didn't know about preeclampsia is that oftentimes they talk about the cure being delivery of your baby, and that's true. But what they don't often talk about is that you can still have symptoms of preeclampsia, and oftentimes that's related to having high blood pressure. That can take up to 6 weeks after you have your baby. And so what I'd like for people to take away from this is that reminder that just because you've had the baby, and while it might be stressful to have a baby in the NICU and that be the thing that you really want to focus on, as a mom, you may still need to be taking care of yourself. You may still need to be getting your blood pressure checked, and you may not feel as good as you could. And it's okay. It's okay to take time to take care of yourself, take the medications that's prescribed to you, get rest and good nutrition. And if your baby's in the NICU, know that we are taking good care of your baby so that you can take this time to heal and recover